Why is revision surgery recovery often longer? Imagine going back to a place you've already been, but this time, things are a bit more complicated. That's similar to what happens during revision surgery. When a patient needs a second or even third surgery to fix or improve on an initial procedure, recovery tends to take more time. This is because the body has already experienced trauma from the first surgery, and healing now has to navigate through that previous damage. One big reason recovery takes longer is the presence of scar tissue. Scar tissue forms as the body heals after surgery, but it is less elastic and has less blood flow than normal tissue. This means it doesn't heal as quickly or as easily. Surgeons often have to work carefully around these scars, sometimes removing or dissecting through them. This extra manipulation causes additional trauma, which can extend the healing process. Revision surgeries are also more complex than first-time procedures. They often involve correcting or adjusting previous work, which can mean more extensive tissue handling, longer surgery times, and sometimes additional techniques. For example, if a patient has an implant that needs repositioning or removal, or if there is a deformity to correct, the surgeon must work more carefully, which adds to the overall trauma and prolongs recovery. The quality of tissues involved in revision surgeries can be compromised. Prior surgeries, radiation treatments, or infections can weaken tissues and reduce blood flow. When blood supply is limited, oxygen and nutrients don't reach tissues as efficiently, slowing down healing and increasing swelling or bruising. This makes the recovery process longer and sometimes more uncomfortable. Inflammation and swelling are also more intense during revision surgeries. Because tissues are being re-injured, the body's inflammatory response is often stronger or lasts longer. This results in more swelling, bruising, and pain, which can take extra time to settle down. Patients may notice that their swelling peaks in the first few days but can persist for weeks, especially with more extensive revisions. Individual health factors play a role too. Age, overall health, and how well a person heals naturally influence recovery time. The extent of the revision matters as well. A simple implant removal might heal faster than a procedure that involves reshaping or reconstructing large areas. The more extensive the surgery, the longer the healing process. Post-operative care is crucial in these cases. Patients often need longer periods of wearing compression garments, managing pain, and limiting activity. Healing occurs in stages: initial inflammation, tissue remodeling, and final maturation, and each of these stages can be prolonged in revision cases. For example, recovery from breast revision surgery can take anywhere from 4 to 8 weeks. Swelling and discomfort are usually at their worst in the first few days, but it can take months for tissues to fully settle and for final results to appear. Similarly, revision rhinoplasty, which involves reshaping the nose after an initial surgery, often requires careful management of swelling and prolonged healing to ensure the nasal structures settle properly. In summary, recovery after revision surgery tends to be longer because the body is healing from additional trauma in tissues that have already been altered. Scar tissue, reduced blood supply, increased surgical complexity, and individual health all contribute to a more cautious and extended healing process. It's important for patients to have realistic expectations and to work closely with their surgeons to ensure proper healing and the best possible results. Always consult with a qualified healthcare professional for personalized advice and to understand what recovery might look like for your specific situation.